doing good.
This is an NBC News special report. Here's Kate Snow.
Good morning. We come on the air this morning because the president's medical team is about to provide an update on his condition. The president remains at Walter Reed Medical Center after arriving there on Friday night. His doctor, Sean Connolly, speaking now.
Frequent ups and downs over the course, particularly when a patient is being so closely watched 24 hours a day. We review and debate every finding, compare it to existing science and literature, weighing the risks and benefits of every intervention, its timing, as well as any potential impacts a delay may have. Over the course of his illness, the president has experienced 2 episodes of transient drops in his oxygen saturation. We debated the reasons for this and whether we'd even intervene. It was a determination of the team, based predominantly on the timeline from the initial diagnosis, that we initiate dexamethasone. I'd like to take this opportunity now, given some speculation over the course of the illness, the last couple of days, update you on the course of his own illness. Thursday night into Friday morning when I left the bedside, the president was doing well, with only mild symptoms, and his oxygen was in the high 90s. Late Friday morning when I returned to the bedside, the president had a high fever, and his oxygen saturation was transiently dipping below 94%. Given these 2 developments, I was concerned for possible rapid progression of the illness. I recommended the president we try some supplemental oxygen, see how he'd respond. He was fairly adamant that he didn't need it. He was not short of breath. He was tired, had the fever, and that was about it. And after about a minute, on only 2 liters, his saturation levels were back over 95%. Stayed on that for about an hour, maybe, and it was off and gone. Later that day, by the time the team here was at the bedside, the president had been up out of bed, moving about the residence with only mild symptoms. Despite this, everyone agreed the best course of action was to move to Walter Reed for a more thorough evaluation and monitoring. Now I'd like to invite up Dr. Dooley to discuss the current plan.
Thank you, Dr. Connolly. Before I begin a brief clinical update on the president's condition, I do want to reiterate my comments from yesterday regarding how proud I am to be a part of this multidisciplinary, multi-institutional team of clinical professionals behind me, and what an honor it is to care for the president here at Walter Reed National Military Medical Center. Regarding his clinical status, the patient continues to improve. He has remained without fever since Friday morning. His vital signs are stable. From a pulmonary standpoint, he remains on room air this morning and is not complaining of shortness of breath or other significant respiratory symptoms. He's ambulating himself, walking around the White House Medical Unit without limitation or disability. Our continued monitoring of his cardiac, liver, and kidney function demonstrates continued normal findings or improving findings. And I'll now turn it over to Dr. Garibaldi from Johns Hopkins to talk about our therapeutics and, again, our plan for the day.
Thank you, Dr. Dooley, and I just wanted to again reiterate what an honor and a privilege it is to take care of the president, but to be part of such a talented and multidisciplinary team here at Walter Reed. The president yesterday evening completed his 2nd dose of remdesivir. He's tolerated that infusion well. We've been monitoring for any potential side effects, and he has had none that we can tell. His liver and kidney function have remained normal, and we continue to plan to use a 5-day course of remdesivir. In response to transient low oxygen levels, as Dr. Conley has discussed, we did initiate dexamethasone therapy, and he received his 1st dose of that yesterday, and our plan is to continue that for the time being. Today he feels well. He's been up and around. Our plan for today is to have him to eat and drink, be up out of bed as much as possible, to be mobile. And if he continues to look and feel as well as he does today, our hope is that we can plan for a discharge as early as tomorrow to the White House, where he can continue his treatment course. Thank you very much, and I'll turn it over to Dr. Connolly for any questions.
Just a moment, please. The President wanted me to share how proud he is of the group, what an honor it is for him to be receiving his care here at Walter Reed, surrounded by such incredible talent, academic leaders, department chairs, internationally renowned researchers and clinicians, including the support of Dr. Garibaldi from Johns Hopkins. I'd like to reiterate how pleased we all are with the President's recovery. And with that, I'll take your question.
Thank you so much. Dr. Conley, you said that there were 2 instances where he had drops in oxygen. Can you walk us through the second one? And also, I've got a question for the lung specialist afterwards.
Sure, yeah. Yesterday, there was another episode where he dropped down about 93%. He doesn't ever feel short of breath. We watched it, and it returned back up. As I said, we evaluate all of these, and given the timeline where he is in the course of illness, you know, we are trying to maximize everything that we could do for him, and we debated whether we'd even start it, the dexamethasone, and we decided that in this case, the potential benefits early on the course probably outweighed any risks at this time.
Did you give him a second round of supplemental oxygen yesterday?
I'd have to check with the nursing staff. I don't think that if he did, it was very, very limited. But he's not on oxygen, and the only oxygen that I ordered or that we provided was that Friday morning initially.
And about what time was that yesterday?
Yesterday. What was yesterday?
You said the second instance.
Second incidence? Oh, it was over the course of the day. Yeah, yesterday morning.
Dr. Conley, what is the President's current blood oxygen level? That's my first question to you, Dr. Conley.
98%.
And what do the X-rays and the CT scans show? Are there signs of pneumonia? Are there signs of lung involvement or any damage to the lungs?
Yeah, so we're tracking all of that. There's some expected findings, but nothing of any major clinical concern.
And why start him, Dr. Conley, on the expected findings? Dr. Conley, why start?
Ask if his oxygen level ever dipped below 90?
We don't have any recordings here of that. That's right.
The dexamethasone, Dr. Yeah, what about here? At the White House or here, anything below 90, just to follow up on her question?
No, it was below 94%. It wasn't down into the low 80s or anything. No.
So, okay, so on the dexamethasone, the steroids, sir, on the lung function?
Yesterday you told us that the President was in great shape, had been in good shape and fever-free for the previous 24 hours. Minutes after your press conference, White House Chief of Staff Mark Meadows told reporters that the President's vitals were very concerning over the past 24 hours. Simple question for the American people. Whose statements about the President's health should we believe?
So the Chief and I work side by side, and I think his statement was misconstrued. What he meant was that 24 hours ago, when he and I were checking on the President, that there was that momentary episode of the high fever and that temporary drop in the saturation, which prompted us to act expediently to move him up here. Fortunately, that was really a very transient, limited episode. A couple hours later, he was back up, mild again. I'm not going to speculate what that limited episode was about so early in the course, but he's doing well.
What are the expected findings on his lungs, and why is the President not wearing a mask in the videos and photos that have been released?
Well, the President wears a mask anytime he's around us, and we're all wearing our N95s, full PPE. He's the patient, and when we can, when he'll move out into to public, we move him out and around other people that aren't in full PPE. I assure you, he'll as long as he's still under my care, we'll talk about him wearing a mask.
And he's in a negative pressure room? And the room is negative pressure?
I'm not going to get into the specifics of his care.
And can you answer the questions on the lung function? The lung function question, Dr. Conley?
I'm sorry?
The lung function question. Can you talk about that and what these expected findings?
I would just share that, like every patient, we perform lung spirometry on him, and he's maxing it out. We told him, see what you can do, and it's over 2,500 milliliters each time. He's doing great. Yeah.
But are your scans showing any irregularities in his lungs? Are there any obesities? Are there anything?
To disclose that the President had been administered oxygen?
It's a good question.
Thank you.
I was trying to reflect the upbeat attitude that the team, the President, that his course of illness has had. I didn't want to give any information that might steer the course of illness in another direction, and in doing so, it came off that we were trying to hide something, which wasn't necessarily true. So here I have it. He is the fact of the matter is that he's doing really well. That he is responding, and as the team said, if everything continues to go well, we're going to start discharge planning back to the White House. That's it. Thank you, folks.
Dr. Conley, on his lung scans.
This is again, you did this yesterday. Can you please explain what you found on his lung scan?
All right, this is Kate Snow in New York. Let's go quickly to Dr. John Torres, our medical contributor. Dr. John, a lot to unpack right there. So let's start with what we just learned about what happened on Friday. His physician telling us that he had an incident where his blood oxygen level dropped on Friday morning to below 94%. Maybe you can explain to the audience what that means. I know because my husband was sick that that's a warning sign.
That is a warning sign because if you remember, this is a respiratory virus, so it affects the lungs. That's when we start getting concerned, especially in the initial symptoms and the initial days of COVID. And so the fact that his oxygen level dropped, and granted, it didn't drop that much. You usually get very nervous when it starts going below 90, so 94% isn't that big of a drop, but it's still a concerning drop. And then he had a second episode yesterday where they say the same thing, his oxygen level dropped again, and then it went back up. So what we're seeing here are his symptoms kind of waxing
yesterday.
And waning over the last couple of days. Exactly, 93% yesterday, so it got down even lower. Again, his symptoms are going back and forth. To me, one of the more concerning things is, and I talked about this yesterday, is to see if they start him on dexamethasone, because once they start him on dexamethasone, that means his symptoms are more than mild or moderate. And right now I want to just read to you what the NIH's guidelines are for dexamethasone. They're for patients who are mechanically ventilated and hospitalized patients who require supplemental oxygen but are not ventilated. The panel recommends against using dexamethasone for the treatment of COVID-19 in patients who do not require supplemental oxygen. And so the fact that they started him on dexamethasone, to me, is a big red flag that there's a little bit more going on here than we're hearing about. And particularly it's affecting his lungs, which gets to be very concerning because we're not even at that 7 to 10 day period yet when we get really worried about the lung, Kate.
Right. I want you to back up a step for us, Dr. John, because we're not doctors out here. When you say dexamethasone, I had to look it up. What are we talking about? What is that? Is that a standard treatment for people who are, as you say, perhaps not just mildly ill?
It's a standard treatment for patients who are severely ill, and that's the big concern here, because if they're mildly or moderately ill, dexamethasone is a steroid. Its job is to suppress the immune system, and the reason they give it to patients who are severely ill is because they want to make sure they don't get that cytokine storm. They don't get that immune function going into overload that can start attacking the body. And so they say, let's do this for patients who are severely ill, who are mechanically ventilated or on supplemental oxygen, but we recommend against giving it to patients who are not on supplemental oxygen or ventilated, because in that case it's going to suppress the immune system and it won't be able to fight off COVID in those early stages. And so the fact that he got this steroid, the fact that he got dexamethasone, again sends up a bit of a red flag that there's something going on here. He's a little worse off than what we're hearing, because I think they might be painting a bit of a rosy picture for everybody. And to me, Kate, out of everything that Dr. Connolly and the other doctor said, that's the most concerning part.
Dr. Natalie Azar, thank you, Dr. John Torres. Dr. Natalie Azar is with us as well, another medical contributor here at NBC News. Dr. Azar, when you hear them say that his lung function, I believe they used the word doing great. Yeah, doing great was the quote in terms of his lung function, but he is using a spirometer, which is a plastic device that people might be familiar with if they've been in the hospital or had surgery, where you sort of practice breathing, right, into a tube. So what does that tell us about his lung function?
Well, a lot to unpack here, Kate. So, yeah, specifically to your question, you may recall we've had conversations around positioning of patients in the hospital when they're sick with COVID-19, that proning position, because the concern is that there are areas of the lung sacs collapse, and that can increase, the risk for having respiratory compromise. So, right, the incentive spirometry is basically just keeping the airway and the air sacs open so that, most of the lung can be ventilated. And to echo what Dr. Torres was saying, I do find it very curious that they gave him dexamethasone this early. To remind the viewers, we think there's two phases to this illness, where early on, we're really trying to get get rid of that viral burden, partially using the monoclonal antibody to boost the patient's immune response sort of in a passive way. And then the remdesivir, which was also initiated a little bit on the earlier side, or now that we know that he was in fact receiving supplemental oxygen, that would be consistent with guidelines to inhibit viral replication. And again, as Dr. Torres said, the dexamethasone typically comes into play much later when we're trying to combat that hyperimmune response. Pardon?
Okay, I have lost your audio. I'm not sure if the audience can hear, but let me go to NBC political director and moderator of Meet the Press, Chuck Todd, who's with us as well. Chuck, we did hear a bit of good news in the doctors saying that the president may be well enough to be discharged soon, potentially even tomorrow.
Well, yeah, except not after I just listened to Drs. Torres and Azar. And frankly, when you heard the briefing, and we had a doctor on Meet the Press earlier today, another one of our contributors, Dr. Bedelia, who had said, be on the lookout for if you hear that being used, dextromethasone, if you hear that being used, that is not necessarily a positive sign or a sign that he's going to be leaving anytime soon. So, look, Kate, you and I aren't the medical professionals here. I will just say this. I thought at least was a better briefing, obviously, than what we got yesterday. There still was some halting uncertainties, and I do think the communication issue at the White House to the public on the president's conditions still has a lot more that can be improved upon, because that ultimately is, I think, what was so frustrating to, frankly, White House staffers, members of the public, that we did not have, we were getting these contradictory statements from the chief of staff and the president's physician. Look, I'm empathetic to the president's physician in this respect. Patient, you want to have some privacy for your patients. You feel like that you owe them that, doctor-patient privilege. At the same time, I think the public's owed a clear presentation of this as well.
All right, Chuck Todd, thank you. We're going to have much more on this tonight on NBC Nightly News, including a closer look at the president's doctor, who he is. For now, I'm Kate Snow. We'll bring you more updates as we have them. Have a good day.
We now join our regularly scheduled program already in progress.